Also talking about our cancer update. So important in our community to know the technology that is available and exactly what it does. So this morning I'm at CBCC, and joining me bright and early this morning, as he always does, Dr. Patel. Thank you so much for joining me.
Thank you, Kevin.
You know, so many times we're in the studio for our cancer update, but I really wanted to get out and come to CBCC so you could talk a little bit about the technology that you have here for those battling cancer. And in here right now, we're talking about the CyberKnife. Talk a little bit about this technology.
You know, the journey of cancer, of course, is a difficult one, and we want to make it very comfortable for the patients. Many patients who are older cannot undergo surgery for tumors which are deeply located within the body. And so we have to come up with another option for those kind of patients. If, for example, they have a tumor deep in the brain, a person who could have a lung cancer deep in the lungs, surgery for older people would be difficult, but then we should come up with equally good options for them, which are non-invasive. And this technology, called the CyberKnife, it says CyberKnife, it's a knife in the space, you know.
So this is the bed that a patient would typically lay on.
So say, for example, a patient had a tumor in the brain, they would be laying down here, and the head would be located here, and this machine would literally move like a robot.
Because this is actually the CyberKnife.
It's the CyberKnife, and it's agile, and it can target the beam precisely in the area of the brain and target the areas which are involved with cancer. So it has the agility and the mobility to move very flexibly around the individual. And our physicists plan the treatment and feed it into the computer. And then it takes weeks to do it, but once it's done, it's delivered accurately.
Now, people may be looking at this and thinking, this is high-tech technology. I can't afford it. What about insurance and Medicaid and things like that?
So all of the insurances, Medicare does cover it, Blue Cross, all the payers now cover it because it works out better for the patients. And also, it's non-surgical, which also is saving costs to the insurance. Complications of surgery, complications of hospitalization. Not all patients can benefit from it, but those who can, it's an excellent option.
And for Kern County, this is a one-of-a-kind.
Yes.
You guys are the only ones at CBCC to have the CyberKnife, correct?
Yes, we are the only people in Kern County having it. And many patients from the Central Valley come to get treatment on the CyberKnife.
And I can remember when you installed this 10 years ago, because as I walked in this room, I looked up and there's a beautiful like a sky portrait. So when you're getting your treatment, this is kind of what you're looking up and seeing. And I remember back 10 years ago when you put this in, I remember how warm that made people feel.
Yes, because you know the regular radiation therapy rooms are called vaults. So you know you hear the word vault and it's terrorizing, scary. So what we did is we wanted to make sure that it's a very cheerful environment. Even if the patient comes in, it's a uplifting environment. And so we decided to get the skylight and install the skylight so it's bright and cheerful. And they lay down, and when they lay down, they see the sky and the flowers.
Just incredible. And again, we're going to have a lot more from Dr. Patel coming up a little later about the CyberKnife, the technology.